Have you ever wondered if the system designed to protect our most vulnerable is being exploited, and what happens when the government decides to hit the brakes hard? Well, today we're diving into a bombshell decision out of Washington that's creating immediate uncertainty for millions of Americans who rely on home health care and hospice services. Before we continue, if you want to stay on top of everything happening in U.S. politics, hit that subscribe button right now and leave a like. It really helps this channel grow. The Department of Health and Human Services, under the umbrella of the Trump administration, has just enacted a sweeping, 6-month moratorium on new Medicare enrollments for both home health care agencies and hospice providers. This freeze went into effect immediately on Wednesday, a move designed, according to the department, to combat rampant fraud within these sectors of Medicare. The intention, at its core, is to prevent bad actors from enrolling in Medicare and defrauding the system, which, let's be honest, is a legitimate concern for any administration. We've all heard the stories, the schemes, the exploitation of a system meant for care. Fraud costs taxpayers billions, and addressing it is a priority. However, the way this is being implemented raises a significant number of questions and concerns. This isn't a slow, phased rollout, this is an immediate stop. What this means is that any new home health care provider or hospice facility that wasn't already enrolled in Medicare as of Wednesday is now effectively barred from enrolling for the next 6 months. This is a dramatic step, and the sheer speed at which it's been deployed suggests a high level of urgency from the administration's perspective. So, who is actually affected by this? On one hand, you have the federal government aiming to plug what they see as gaping holes in the Medicare system, potentially saving taxpayer money and preventing fraudulent claims. This could, in theory, lead to a more secure and efficient system down the line. But on the other hand, and this is where the complexity truly lies, you have the very real impact on patients and legitimate healthcare providers. For patients, this could mean delayed access to essential care. Imagine someone recovering from surgery, needing in-home physical therapy or nursing care. If their chosen provider is new and hasn't yet navigated the complex Medicare enrollment process, or if they're a patient transitioning to a new provider that's just starting out, they might face significant hurdles. This could translate to longer recovery times, increased reliance on family members for care that should be professionally provided, and potentially a decline in their overall health status. For hospice patients, who are often nearing the end of life, every day counts. A delay in accessing services can mean less time with loved ones, less comfort, and less support during an incredibly vulnerable period. Then there are the providers themselves. For established agencies, this might not be an immediate crisis, but it certainly creates a chilling effect. For new businesses looking to enter the market, particularly in underserved areas where new providers are desperately needed, this moratorium can be a death knell. These new providers often bring fresh approaches, innovative models of care, and much-needed competition. Blocking their ability to enroll in Medicare for 6 months can stifle growth, lead to financial instability, and ultimately reduce the availability of home health and hospice services for the very people who need them. Think about communities that might be on the cusp of gaining better healthcare access due to new facilities opening up. This freeze could put those advancements on indefinite hold. The administration's argument is that they are preventing fraudulent entities from getting their hands on Medicare funds. And that is a crucial goal. We've seen extensive reports and investigations detailing how billions have been lost to scams involving fraudulent billing for services never rendered, or for unnecessary treatments. The Centers for Medicare/Medicaid Services, CMS, has been trying to ramp up its oversight, and this moratorium is a tool in that effort. It's essentially a pause button, allowing the government time to reevaluate and strengthen its vetting processes for new enrollees. They're hoping to weed out the bad apples before they can cause further damage. But the collateral damage is a serious consideration. Critics argue that a blanket moratorium, while seemingly decisive, is a blunt instrument. It catches legitimate, honest providers in its net along with the fraudsters. It doesn't differentiate. It doesn't account for the specific needs of a growing elderly population that increasingly prefers home-based care. It also raises questions about the transparency of the process. Was there ample warning? Were stakeholders consulted? Or was this a top-down directive implemented with immediate effect? The lack of prior notice for many in the industry suggests the latter, and that often leads to greater disruption. What are the potential outcomes? In the short term, we're likely to see increased strain on existing Medicare-certified providers. They may have to absorb more patients, potentially leading to longer wait times and overworked staff. We could also see a rise in out-of-pocket expenses for patients who can't access Medicare-covered services and have to seek private care. In the longer term, if this moratorium leads to a more robust and fraud-resistant system, it could be seen as a necessary, albeit painful, step. However, if it significantly limits access to care or cripples legitimate healthcare businesses, it could be viewed as a policy that prioritizes a broad-stroke solution over nuanced, targeted enforcement. It's a delicate balance between protecting the integrity of a massive federal program and ensuring that those it's meant to serve can actually receive the care they need. So what do you think about this? Is this freeze a necessary evil to combat fraud, or is it an overreach that will harm patients and legitimate businesses? Drop your opinion in the comments below. I read every single one. This is a developing story, and the full ramifications will undoubtedly unfold over the coming months. We'll be watching closely to see how this policy evolves and what impact it has on the healthcare landscape for all Americans. Stay informed, stay engaged.